From Medvale Media, this is Megaphone. I'm Dave Self. This is the place where we hand the megaphone to healthcare leaders to share their thoughts, their perspectives, and the occasional rant about the increasingly dynamic world of healthcare. And even over the last year plus, I guess, we've been providing this podcast to the world. It has gotten increasingly weird in healthcare. HR1 at the federal level and all sorts of things impacting everyone who delivers healthcare. And today, we're really, really thrilled to welcome Amber Jordan, the CEO of Desert Sage Health based in Mountain Home, Idaho, and also a longtime member of Medvale.
Good
Amber,
morning.
thanks for joining us.
Thanks for having me.
A little housekeeping first. People often refer to you as AJ, so I am not being disrespectful for the viewers. If folks hear me call out AJ during our time today, Amber and I have known each other for a bit, and sometimes it's Amber, sometimes it's AJ, but it's always the same remarkable human being. And today marks another first at Megaphone as well. We've hosted a lot of interesting, very accomplished people, but this is the first time we've welcomed a world class, easy for me to say, national champion and Olympic level athlete who's also a personal trainer, a massage therapist, a Gallup certified strengths coach, and a PMP, a project management professional. That's quite a lineup of accomplishments, AJ. Can you give us a quick description of your roots, where you're from, how you started, and the things you've experienced along the way that have led you to Desert Sage?
Sure. I was born and raised in Alaska. My parents moved up there. My dad moved up there during the pipeline days. My mom was a third generation Alaskan, so my roots are there, and they'll always be there. I live in Idaho these days, but my heart is always in Alaska. I came up as a regular kid growing up, just doing sports, living in the outdoors, being an Alaskan kid, and really enjoyed that. And as I grew up, I knew that I was interested in healthcare, but knew I didn't want to go to medical school, so never really could find my way into that. So I graduated from high school, went on to college at the University of Alaska Fairbanks, and thankfully was ever able to shoot there as a competitive athlete for 4 years on an NCAA rifle team, which was great. And got my degree in journalism and publishing, minor in geology. It doesn't make any sense, but I was just
All
great in
over the
journalism.
map. This
I
is awesome.
I was always all over the map, a multi-passionate person. So, but got to the end of school and had no idea what I wanted to do, and thankfully was competing at a pretty high level at that time, and won a big national match that allowed me to make the world championship team for that year, and also qualified me to become a resident at the Olympic Training Center. So I was able to delay my career. Delay my career aspirations for a few years while I focused on being an elite athlete.
That is fantastic. I love the twisted paths that so many of us take, but yours is absolutely fascinating. I've got to say that it's quite an amalgam of stuff.
It is, yes.
I didn't know about
Uh,
the journalism part, but that makes sense because you're so well spoken, well written.
Oh, well, thank you. Yes, I loved communication. I loved multimedia, and thankfully that's a job that carries over into anything you do. I did work at my local newspaper for, I don't know, it was 3 to 6 months maybe after school before I left for the Olympic Training Center, and I was just a little devastated to find out that was not what I thought it was. So I'd spent 4 years getting a degree, and at least the newspaper world was definitely not for me. So it was good timing to have a little delay in life to sort through things.
Well, one of our common good friends and also Medvalista, Dr. Jim Souza, he was a journalism major too, and I think English is somewhere along there. So,
I did
and he
not know
became a
that about
physician. So, you started journalism and you go somewhere else apparently.
you. That's
So
right. That's right.
let's fast forward to 2025. You're a full year into your role as CEO at a federally qualified health center organization. The world of healthcare can feel like a massive swirl of uncertainty today. And in the midst of this really dynamic environment, what do you remain focused on as the executive leader of Desert Sage?
I have said for many years now that my job is to take care of the people who take care of the people. And so, regardless of policy changes, regardless of staffing changes or leadership changes, or what scary things are happening in the healthcare world, my job is to take care of them. It's to make sure that they feel informed, that they know that leadership is on top of things, that we're paying attention and communicating what's happening on the political scene, even if it's confusing. And then just giving people a sense of calm and steadiness so that they can show up and do their best work every day and just take care of patients without having to worry that there's things going on in the background that they may not be informed about.
Well, there's a through line to what you just described, and some of the things that I've seen you post most. Well, the one I saw most recently was, I assume, your team, a group of folks outside of a truck or a van, and the message was simple. It was, this team right now essentially doing good work in the community.
That's
Um,
right.
that
That's
that
right.
seems to be the vibe of Desert Sage in the community.
It is. Yes. And I think it has been for a long time. One of the things that I think makes us maybe a little more flexible than other health centers right now is our prior CEO just had was immensely gifted in financial management and also strategic financial and operational management. And so she set the health center on a path for a significant financial cushion that allowed us to build the new clinic that we're in, that allowed us to purchase the mobile medical unit, to do some very innovative things with our new building, like drive-through healthcare, drive-through sick care. And so it's been my job to carry that financial strategy forward and to keep us operating administratively in a very lean way while also innovating and rolling with the punches that have come over the last 6 months.
Well, a drive-through for services at an FQHC, it feels unique to me, and I don't pretend to be an expert on all FQHCs, but that feels like an interesting way to serve the community in that particular clinic space.
It is. And I try to stay on top of it and try to research it periodically so I don't speak out of turn. But I believe it's the only permanent drive through clinic in the country, regardless of whether FQHC or regular healthcare operation. But it's been a huge benefit to the community, especially in a new, beautiful building. I think when you're serving underserved populations, having a really warm, welcoming, clean, and new space for them to get their healthcare in really feels like something that's high value. And the drive-through clinic in particular has been beneficial for we use it primarily for sick care, not so much for things like broken bones, but for a mom with a car full of sick kids to come in and not have to unload all those kiddos and bring them into the clinic, and then especially for our elderly patients who have mobility issues, being able to stay in their car and have a visit and just stay in there. They go get their prescription in their car, they pick it up, they go home, and they don't have to get in and out. It's a huge blessing for them.
It really gives a new meaning, to me anyway, to the idea of meeting people where they are.
Exactly, exactly. The world is drive-through these days. Drive-through coffee, drive-through banking. Why not drive-through healthcare?
Truly, good call. Does it feel like the Public Health Service Act will remain intact despite all the changes at the federal agencies? What's your take on that?
Um, hmm.
And that's a big question because it's been around a while. I believe it was one of
Yes,
the enabling acts that created FQHCs.
it is. I would like to say yes. I think it's we know it's something that's been supported in a bipartisan way throughout history. I think it's just going to look very different in the coming years. We've certainly seen some agency changes that have made things different for us already in terms of support with our project officers and people at HRSA. I'm not sure what the compliance environment is going to look like as we move forward under the current administration. And then I think it's possible that there could be a move for health centers to actually consolidate to create fewer entities so that there's less management at the federal level. And those are just guesses. Those are just things that
Sure.
I could potentially see coming. But yeah, I think it will look different as healthcare evolves and as the need of the communities and especially rural America evolve.
Well, correct me if this is not accurate, but right now, at least in this neck of the woods, the FQHCs have their own consortium, their own association that they are in and collaborate. So I presume that you've got good visibility across the region as to what's going on.
We do. Community health centers typically have a state level association. We also have a regional association and a national level association. So there's layers of support and advocacy and collaboration. So it's much easier to keep our pulse on the health of things that are very specific to FQHCs that are kind of contained within all these big legislation packages.
You operate in a largely rural environment. Is that a safe statement?
Correct.
Okay. Share your thoughts about delivering healthcare in these rural areas. What are the special challenges and maybe some of the upsides of delivering care in a rural environment that are not so obvious to people that are not involved in it?
Right. I think the biggest upside I can think of right off the bat is just the immensely grateful nature of the patients that we serve. They are so caring and so kind. And yes, people don't feel well sometimes when they come into the clinic. Everybody's got a bad day, but in general, our patients are so grateful we're there because they know if it wasn't for FQHCs, they're not a community that's of a size that could support an independent practitioner financially, especially given the payer mix in rural America. So I'm most grateful for the patients. And I think the other thing is the people who serve in rural America serve there for a reason, and it's not to get rich. It's because they really care about taking care of people who are rural and underserved and have a high need and a high disease burden. So you really get the best, I think, most dedicated people working in rural America. Not that all healthcare professionals aren't dedicated, but there's just a special type of person that it takes to
Sure.
be the one person in a small community who everybody goes to. And you're a provider at the grocery store, you're a provider when you're taking a walk or a run, when you're out on the riverbank fishing, you're never off the clock. And so it takes a very special person to fill that need.
That's really well said.
It is. It's an amazing group of people who choose to work in this field. Challenges are, probably some of the more obvious things. Transportation is a huge issue for us in Elmore and Owyhee counties where we serve. We do have a mobile van that we'll use to take people to specialty services appointment, and then we work with transportation providers in the area. But that's always a challenge for us and something we're always working to collaborate on. And that's the other reason we have the mobile medical unit is there's places where it doesn't make sense to run out and get people when you're talking about people who are 2, 3, 4 hours from the nearest clinic. So our job is to take that mobile unit out and deliver care. Even if we only see 5 or 6 patients out there that day, that's people who hopefully are going to avoid an ER or a worsening chronic condition, and that pays off in the long run.
Is there a minority population in the region you serve that has special needs, or are we dealing more with a more homogeneous sort of population?
No, we have a fair number of migrant farm workers that we take care of, especially during the summer, during agricultural season, during ranching season, and so that's a special population that we look out for, mostly seasonally. Otherwise, it's as many farmers, ranchers, and just people who choose to live a rural lifestyle.
For folks that maybe are not as familiar with the great state of Idaho, the region, and specifically where you serve, give us a sense. When we say mountain home, we know there's an Air Force base there, and what, about 40,000 people in the town? Is that roughly right?
14,000, 14,000.
14,000. Oh my
Yes,
goodness. I missed out. Maybe
yes.
that includes the base in the bigger number.
Right, right. Yes, and then Glen Ferry is our other clinic community. There's about 1,200 people there, and then Grandview has about 600. So, and those are those communities where it doesn't make sense for a private practitioner to operate most of the time.
Sure. Truly rural in nature. Um, let's shift gears for just a second. Love to hear your thoughts about Medvale. Why you became involved, why you stay involved. You're becoming a leader in the group as well. So this group of folks. that seem to be on the same sheet of music for a whole lot of issues seems to be important to you.
It is. I've been involved with Medvale since its inception, which was during COVID, and it was really just a group of people getting together to sometimes commiserate and support one another. And it was just a place where leaders who were feeling, I think, a little lonely at the top could come together and talk about what they were doing in their organizations, how they were managing, how they were personally taking care of themselves. And I was introduced to that through Jim, our mayor, and used to work for him when he owned MedMan or medical management. And I was a quality consultant for MedMan for a little over a year before I was adopted by Desert Sage, who was a client of theirs. So I've known Jim for a long time, since I've been in Idaho, basically. But Medvale has really evolved into a higher. I think there's a higher bar these days for Medvale. You really have to be willing to give more than you receive from the group, and that's one of the things that I truly love about it. But it's an incredible group of people who aren't just accomplished and smart, but really deeply concerned about the future of healthcare throughout the country. And I love surrounding myself with people like that. I remember telling Jim when I was at MedMan that that was the first place I'd worked since I left elite sports, where I felt like I had a team of elite people around me. And I feel that same way about Medvale. Is it's just it's the best of the best, and everybody supports one another and makes each other better there.
Several people that we've had the privilege of hosting on the podcast have made the comment that these are my words, but the sentiment seems the same. They look around at the other people in Medvale and say, "Wow, this is amazing. What the heck am I doing here?" But it's that humility that goes along with it that seems to be part of the magic of what makes the community special.
Absolutely. I've told my husband on more than one occasion, usually after an in-person event, that I don't know how the heck I got here. I don't know how it ended up being that I got to hang out with these people, because it's truly an incredible group.
Well, I'm pretty sure that we all know how you got there, so don't downplay that part. We'll say all the good things about you so you don't have to. You attended summer camp 2025 in Sun Valley. Were there any big takeaways or aha moments that you had during that? I mean, this is a shameless plug for folks to think about summer camp 2026. I'm slipping that in because I'm sure the mayor will appreciate it, and I'm trying to suck up to him. So, um, anything that you could take away from the time in Sun Valley with your colleagues?
Yes, there were 2 big takeaways for me. The first one was just the power of human connection and the depth of the relationships that you can build in just a couple of days with people that you know virtually. And we all know that virtual is great, but there's just no substitute for in-person connection. And so to come together with people who you've known virtually for 6 months or 12 months, certainly not decades, and to feel like you're instantly connected, you know a lot about one another, and then just to have these real, genuine, supportive conversations, vulnerable conversations about things that are going on in personal lives and professional lives. I've never experienced rapid connection like that before. So that was one of my favorite things. On the technical level, we went through a scenario planning activity there where we looked at a fictional scenario of what might be happening in healthcare in the long run and learned these tools and techniques for looking forward strategically and coming up with triggers and plans and potential solutions should an event like that come true. And what was extremely enlightening for me was the fact that the scenario we worked on had been written several months before we came to summer camp, and some of those circumstances had already come true by the time we came together to talk about them. So very fruitful event, and just a skill set that I really appreciated learning that I could take back to my executive team, and just another way to bond with people professionally and to learn from them there.
It was quite an interesting time to be at a table looking at people who are deeply passionate about delivering healthcare to people who need it most when they need it most,
Right.
and watching them start to twitch a little about the scenario planning, and those things were in process during that during that time. It
Right.
wasn't those headlines were real at that moment. So it was fascinating to see people lean into it a little bit because it wasn't just prognostication anymore. It was when we leave this place, we're going to be dealing with some of these issues.
Right. Right, and I think that that was so enlightening to me. As you know, one of the things that, I'm working on right now within Medvale is a scenario planning for our Idaho-based, executives, along with some guests and non-Medvale people who just have a lot to contribute to the conversation. So, in, November, December timeframe, we're gonna be getting together as a group to look at, what's happening on the national scene, but how does it specifically apply to healthcare delivery in Idaho? And I'm so excited about that because it's just going to be a diverse and very smart group that I think can come up not with just solutions, but the things that we can actually advocate for and potentially implement and see the benefits of that. Whereas on the national scale, it can be a little bit harder to understand what our impact might be.
This is truly a team sport. So kudos to you for putting together a group of folks to come together and be a team and talk about the things that can be accomplished together.
Yeah, well, thank you. It's my learning. I'm selfishly doing it so I can be around really cool people.
That's okay. Every leader is a little bit selfish. They
That's right.
continue to learn. That's what makes them a leader.
That's right.
So, thinking about the national scene for a minute, what are the one or two things that give you pause? You may not have to lose sleep over it, but you're thinking about it when your eyes open. What are the
Mm.
things nationally that you believe are causing that extraordinary external pressure that could start to change the world that you're accountable for at Desert Sage?
Right. Well, I don't think I have anything particularly different than others. Idaho moved on work requirements for Medicaid and really trying to reduce the size of the group that's receiving Medicare benefits already this spring. So we're preparing for those requirements ahead of what's required nationally. So in some ways, it's a gift that we have to move a little more quickly because we're going to be ready before the national requirements hit. But because of the population we serve, low literacy, low health literacy, sometimes working jobs under the table to get by. We have a lot of people with English as a second language. And so navigating those requirements is going to be very difficult. So our organization is focused on multiple ways to support people through that. First of all, is just creating lists of work opportunities, volunteer opportunities, making sure that we can provide educational sessions for people who truly need Medicaid benefits to be able to get through that administrative process and keep Medicaid. So we're even talking about how do we create volunteer opportunities for people who have circumstances that make it very difficult for them to work.
Really?
Yes, yes.
Now that's a creative approach. Maybe that's
It
something we
is.
should all be adapting for folks working in the healthcare delivery space. If we also go upstream a little bit, love to hear your thoughts about the implication at the end of 2025 when the current advanced premium tax credits and benefit support are scheduled, in the absence of a diving catch by the Congress in Washington, D.C., they're scheduled to expire. And nationally, I believe the number is 16 million people are expected to lose their current benefits under the Affordable Care Act. Um, those folks may not qualify for Medicaid, especially under the new rules.
Right,
Um, so that gap population in the area that you serve, in the region you serve, that group of folks could increase significantly.
right. Yes, and we're already seeing it. Thankfully, that's what FQHCs are set up for. We have our sliding fee program for a reason. That's primarily for people who don't have other coverage or who are underinsured, and that's why we receive federal grant funding is to prop up the costs that we have for taking care of that population. But that's one of those things that keeps me awake at night. Already at the state level, we've seen at least in our payer mix, we've seen a 5% decrease in Medicaid visits and a 5% increase in self-pay visits. I believe from some of the things that are happening in the Healthy Connections program, which is our Idaho Medicaid program. And so that happened much more quickly than I was expecting, but it's something that we knew was coming. And so we're trying to find creative ways to make sure that we've got income coming in from those patients who can pay and who are covered so that we can support the care of the people who need it as we plan to see more self-pay patients in the coming years.
So, gazing into your crystal ball, is that maybe one of the top challenges that you would foresee in the near term?
That is the top challenge for us. Absolutely.
What are the other things swirling about that you might look into that crystal ball and say, "Huh, we should be addressing that."
Mm,
An example would be women's health. Another example would be prescription medications and support from 340B programs, things like that.
right. 340B prescription rebate program has been in our horizon for quite a long time. And that program has been changing rapidly over the last 5 years or so. Manufacturers are putting significant restrictions on those rebate programs, and so we have seen the declines in revenue from that particular program. And we've also seen not manufacturers but contract pharmacies saying we are not going to honor your patient self pay programs anymore, so it is creating difficulty for patient access around affordable medication. And I don't think that's going to get any better based on some of the things that are happening at the national level now. So affordable medications always, always an issue, especially for those populations with high chronic disease burden. Certainly worrisome on that front. And from a revenue perspective as well, we use 340B cost savings to support that self pay care that I was just talking about. So as the manufacturers just start to put more restrictions on there, or continue to put restrictions on that program, it makes it harder and harder for us to take care of those self pay patients.
We've talked about the challenges. You mentioned a couple of the upsides, but so that we don't leave folks on a flaming bummer, why don't we touch on some of the real bright spots at Desert Sage? How many people annually, roughly, do you serve?
We serve about 8,000 people annually.
And with any increases going forward due to the dynamics that we've touched on, you feel confident that you're able to staff up for that, be able to support that?
I do, thankfully. As I mentioned earlier, FQHCs draw a particular type of mission driven person, but we also have the benefit of being in a healthcare professional shortage area and having access to the National Health Service Corps loan repayment program for our providers. So that does help us get people in the door for at least a 3 year commitment. And then we hope they fall in love with us and stay long term. But we have an amazing group of people who are so dedicated to what they're doing, and we certainly do expect to see both more self-pay patients and potentially more Medicaid patients coming through our doors, as well as other providers throw their hands up and say we're not playing the game anymore and we're not going to take Medicaid patients. So
Sure.
um, we do have an opportunity to take care of a larger group of those people. And there's lots of great things coming. As I mentioned, our patients are so grateful. They're so thankful to have a place to come for care, especially in rural areas. And when I have a bad day or when I'm frustrated and just feel like, the sky is falling, I go back and read our patient reviews and realize how much our patients love the people who take care of them. And I just go back out and try to take care of those folks.
Right on. Well, with your outdoor background, growing up in Alaska and some of the other pursuits in your, fascinatingly checkered career, what are a couple of the things, the must-do things that people should know about when they come visit Mountain Home or Southwest, South Central Idaho? What should folks be
Wow.
looking to do?
Oh, that's a great question. Well, Pine and Featherville are very popular, maybe too popular for the people who live there. I'm probably going to get an email to say, stop talking about Pine and
Yeah,
Featherville.
you
We don't
probably
want any more
will.
people. But there's great fishing opportunities down at CJ Strike and some of the other lakes down there. There's a few great hiking trails, and you can drive up into the mountains and be into the wilderness within about 30 minutes of Mountain Home. That's one of my favorite things about the location. So opportunities abound, and thankfully that's a great recruiting point for us as well.
Well, Mountain Home should tell people exactly what's special about it because it is a home close to the mountains,
It
and
is.
lot of folks feel very passionately about preserving that quality of life. Okay, last question, then you get the last word. Um, Maria and I continue to build our travel log of interesting places to visit, to eat, and drink. So, what are your recommendations in the region? You can give us a couple.
Ooh, are you talking Mountain Home or the
Oh,
greater Boise area?
anywhere you choose.
Oh
One from
boy.
each. One from
One
each.
from each. Well, in Boise, I have to put in a shameless plug for White Dog Brewing.
Okay.
you, you had to know I was going to say that one.
Well, it
That's
was a thought.
yes, that I mean that's my husband's business, but they partner with a really incredible food outfit called Smoke and Time, and they have fantastic food. I never get tired of their menu. It's constantly rotating. So that is not my husband's business, but they that's one of my favorite places to get food in Boise. Uh, and then in Mountain Home, there is a great little food truck called Main Street Tacos. Very authentic food, pretty well priced. It's easy to find. It's on the main drag, and just really, really wonderful people. We love to cater with them periodically too. So
Main Street
they're
Tacos in Mountain Home and White Dog Brewing in Boise.
you got it.
You heard it here first, folks. And Amber, you get the last word. What message would you like to leave us with today?
I think just if all of us focused on taking care of the people who take care of the people, and we kept that as our north star and our guiding light throughout all the difficult things that are coming and have come through healthcare, that's really the most important thing we can do because they've got a hard job. They face a lot of difficulties every day. They hear a lot of sad stories. They have a lot of victories. So really focus on taking care of them. You can't go wrong with that.
Well, Amber Jordan, thank you so very much for joining us today on Megaphone. It's been a true privilege to learn more about your background, your journey, where you are today, the things you're thinking about for the future. Thanks for taking time to be with us.
Absolutely. Thank you, Dave.
We're at the end of this edition, but join us next time for Megaphone from Medvale Media. I'm Dave Self. Be well.